So what can the LHINs do in the short run and what can't they do? Well, they can't redesign the physician and primary healthcare systems and payment mechanisms. That's still in government's domain. Though I would hope the LHINs would analyze and advocate in this area. I hope they would turn their policy minds to the facilitators and barriers of real reform and integration and achievement. And if these are among them, I think they should speak. They can't close facilities. As I understand the rules, they cannot close them, but they can change their roles. And if you have a very elastic definition of what changing the role means, I think you've got some options there. Nobody wants to close facilities as just an intrinsically good thing to do, but sometimes you have to do it, and sometimes you do have to change the role substantially. The LHINs can promote a modern and comprehensive IT agenda. I think they should be champions for this because it will help them do their jobs better. It will help the system do its jobs better, and it will help people. They can promote progressive change models and build public support, and with the Change Foundation's incubator status as a think tank, I think that partnership should be extraordinarily fruitful over time. And I think the fact that you have an organization that is dedicated to studying the determinants of change is a monumental leap forward for Ontario. I think it's a brilliant strategic plan. Particularly brilliant because you can read it in 20 minutes and think you've read a whole book. I like that. It's succinct, it's short, it's to the point, and it says what it's going to do. And the LHINs can identify the origins and costs of population health disparities and point to solutions. I mean, in some ways, the LHINs have a balancing act. Advocate for and, of course, be stewards of healthcare, but also make the public more and more aware of the limitations of healthcare. That's a balancing act that regions have wrestled with across the country and have wrestled unsuccessfully with.